Welcome to today's program, and thank you for joining us. I am C. Virginia Fields, former Manhattan Borough President and current President and CEO of the National Black Leadership Commission on Health, formerly known as the National Black Leadership Commission on AIDS, Inc. In 2019, after being a leading advocacy organization and change agent, born of 32 years of service to the African American community, and following a 2-year rebranding process, the National Black Leadership Commission on AIDS became known as the National Black Leadership Commission on Health, Black Health. Our mission: to champion promotion of health and prevention of diseases, to reduce disparities and achieve equity within the Black community. Our vision is to reduce disparities and achieve equity, promote the health and wellness of Black communities through education, advocacy, and policy. And with a new mission and vision, Black Health's expanded health focus areas include HIV/AIDS, hepatitis C, cardiovascular disease, breast cancer, prostate cancer, sickle cell, diabetes, and mental health. Each of these areas affect African Americans at vastly disproportionate levels in comparison to other racial ethnic groups, and thus Black Health was formed. This was a major development and organizational evolution to become a comprehensive advocacy, education, and policy group that moved beyond HIV/AIDS to address these multiple health issues and disparities that continue to disproportionately affect African Americans. And today, we will have a powerful discussion on the mental well-being of those on the frontline providers and healthcare workers, in what can be an emotionally and physically exhausting profession. We know that providers suffered greatly during the COVID-19 pandemic. Not only did they risk exposure, but the crisis also hurt their mental health, contributing to anxiety, stress, depressive disorder, and loneliness. So today we're going to take a deeper look into this, as this issue has not been widely talked about, and many have been and still are suffering in silence. And I'm pleased to be joined here today in the studio by Dr. Bert Petersen, Chief of Breast Surgery at St. Barnabas Hospital in the Bronx. And Dr. Petersen, before we begin, and again, I just simply want to thank you for coming here and being with us, and to say that you brought this matter to our attention, because not only are you the Director of Breast Surgery at St. Barnabas, rather, you're also a member of the board for Black Health.
Yes.
And we certainly do benefit so much from your expertise and your knowledge. And let me just say, over the past month or so, Black Health, along with many other organizations, have been acknowledging the impact of mental health, certainly among Black populations. And I think the emphasis again have been on the patients. Just to cite a few statistics, it shows that 16%, 4.8 million of Black and African American people reported a mental illness, and 22.4% of those, 1.1 million, reported a mental illness over the past year. Now, this is within the height of the pandemic. We know that there have been serious mental health illnesses that we're seeing among all ages and especially young people. We also have seen major experiences related to racism, stigma, and other factors that trauma that's driving mental health. And so we've done a lot, and we work with other groups on this, but we have not dived into looking at the impact of this on our medical providers. So when you brought this to the attention of the board when we met back in July in LA, we were all overwhelmed by what you had to say. And of course, now you've also shared articles about the rates of suicide and depressive states that we're seeing medical providers go through. So we want to talk to you today more specifically about what is the mental health crisis among providers and healthcare providers as you are experiencing them. And we've heard a lot about moral injury and professional responsibilities. So we want to talk about the association between moral injury and profession and how that is impacting healthcare workers.
Sure. So I think if you just look at the symptoms that you said that people are experiencing, depression, difficulty sleeping, difficulty like not wanting to eat, the anxiety associated with this, these are typical symptoms that are associated with what we call post-traumatic stress disorder. But mostly when people think of post-traumatic stress disorder, they think of people who have been in the military or people who have been through sexual violence or domestic violence. So in many instances, this syndrome of post-traumatic stress disorder went undiagnosed or unrecognized because no one would associate going to your regular job and doing what is expected of us, which is to take care of the community, as being traumatic, except this was a traumatic event. And we were in it for about 3 years of this constant bombardment. And with every surge of COVID, there was this high alert all over again, because given what we had gone through in 2020, some of us, like myself, being, I think I was the first physician at my hospital to be diagnosed with COVID, and to have my best friend, who also got diagnosed at the same time, my best friend at work, get COVID and die from COVID, and to lose colleagues, not only physicians but nurses, there was this, you're just doing your job, and you're expected to just keep going and keep doing what is expected to you. You know, I'm a surgeon, suck it up, get to work. We got patients to take care of, except it takes an effect on you over time. And this just kept going on. And the other thing that was unrecognized for a lot of people that healthcare workers went through is that as we were seeing so many people dying in our midst, we were having to deal with the grief that the families weren't able to participate in because they were at home. Their family members, their loved ones were dying without them, and we were having to be the interface in all of that grief. So not only were we dealing with what we had to deal with personally, but we had to deal with that of the families as well.
Let me just ask a question at that point, because at that time we were seeing so many bodies just being put in boxes or lined up in funeral homes, etc. And families were not even able to, as you would say, you know, normally be able to see the body or in any way.
That's correct.
So that was happening all at the same time.
All at the same time. So there was all of this. And then I also have the dual role of being the program director of the general surgery residency program. So I have to take care of the health and well-being of my residents who are also on the front line. So there was a lot coming, for me personally, I can tell you, there was a lot coming at me. And when you look at the statistics that are out there, 50% of non-physician healthcare workers are suffering with post-traumatic stress disorder.
50%?
50%. About 35 to 36% of physicians are suffering with some form of post-traumatic stress disorder. And we have about 5,000 physicians every year now leaving the profession. These are not people who are retiring at the normal age, for example, that they would retire. They're just leaving the profession because they've had enough.
And I can say that's traumatic. When your physician leaves and you got to start over with someone else,
exactly.
that is traumatic.
Yeah,
right?
so when you ask about how does bridging all of these other conversations, you're looking at a healthcare delivery system that was already overtaxed, right? It was already being pushed to the limit. And then you bring the pandemic in, which really crippled our ability to meet the demand that was there, which then took everyone to the highest limit of alert and what they were, pushing themselves to actually do what we're trained to do. And so it really took it to an insane level that I just think no one bothered to step back and say, you did well, take a breath. We've sort of, quote unquote, come out of it without any real reassessment of the healthcare, the workforce. How are they doing? How are we doing? Where do we need to, rebuild, restock, retool, re-energize? It's just been keep going.
So what suggestions or recommendations you would make as to how we now take just what you said, assess what happened, because we generally hear not necessarily if there's going to be another pandemic or major disease outbreak, but when.
Yeah.
And are we prepared in terms of lessons learned and everything that you talked about, the emotional turmoil and impact that had, and now the stress that continues. What do you suggest how we prepare, or not necessarily, well, it is preparing, but also emphasize and elevate lessons learned?
I will say that there are a couple institutions, not a couple, there are several institutions across the country that do have some programs in place to support their healthcare workers. But to your question, what I will say is we have to invest in healthcare. Really, it's a money conversation. I think we've ignored the infrastructure of our healthcare in this country for too long, and we have to invest in our healthcare infrastructure, which means, we've closed a lot of community clinics, for example. We've gotten rid of a lot of the resources that were there to meet the needs of the community. And for those of us that are practicing in safety net hospitals and in those communities that were the most vulnerable, we didn't have the resources to meet the need. For example, I got a computer for the first time that had a camera on it during the pandemic, because when patients couldn't come into the hospital, I needed some way to see them and communicate with them. No one bothered to invest in the IT infrastructure, for example. So I think it's going to have to be a comprehensive approach. It's not going to be uniform, because what is needed in Manhattan won't necessarily be what's needed in Harlem or Bronx or in Brooklyn. But we need to take that kind of deep dive and diagnostic assessment, so to speak, of our own profession and look at, well, what do these systems need to be able to meet the needs of their community?
And I think that begins again to speak, and that's why I was just so interested in having you on the show to talk about this, because when we talk about the advocacy component of Black health, that fits perfectly by having this information, understand how can we better advocate to bring this in the to the attention of policy makers in preparation for not just a pandemic or emerging, but just ongoing care for the patients who go into, especially our public hospitals.
Yes, and where all physicians and all healthcare providers have a real interest in taking care of their patients, but particularly in these areas where they're underserved, underprivileged, hard to reach populations, it becomes very difficult to do what you want to do when you're practicing in a healthcare environment that is really more about the bottom line and the dollar, which is, you used this term earlier about moral injury. It's one of the things that I think many physicians are experiencing right now, because you pretty much, and nurses I put into this category as well, you went into this profession because you want to help. But in fact, it's it's an industry that really has been catering more to the bottom line and the financial success of the industry, which sometimes is in conflict with doing what's right and taking care of people regardless of their ability to pay or, you know, how lucrative it is. You just need the resources. So that kind of stress that you're already working under, then you add the pandemic and you add all these things, you know, to say that it's physician or nurse burnout is an understatement. It is traumatic. It is very stressful to go into an environment every single day and to deal with that. And it has an effect on us personally. And each of us have our own issues that we're dealing with. You know, for example, for myself, I find myself really concerned about my own mortality these days. I've witnessed a lot of death over the last 3 years, and I've had a lot of death in my own life personally. And I actually realized about 6 months ago, I'm dealing with anxiety because I notice I'm not sleeping well, and I notice what's waking me up at night is a concern about getting old. Older, exactly. Getting, you know, being able to take care of myself, and will I be able to accomplish all the things that I want to do in life before I die, and all these things, and it gets me, you know, going, and it's really heightened coming out of this pandemic, and it was just something I needed someone to talk to, and I, you know, looked for help to be able to do that.
And that speaks to another problem. Of course, we continue to see the lack of access
Yeah.
to psychiatrists and psychologists, and stigma associated as far as, you know, African Americans even seeking
Yeah.
those kinds of services and care. You mentioned something a minute ago about how this affects, you know, physicians, nurses, and others very differently. But as a Black African American physician yourself,
Yeah.
being confronted with all of the issues that you talked about, and at the same time having to come into your own community, and I know living in a Black community, predominantly Black, and surrounded by the other issues, social determinants that you see in the community, like housing, people still on the street struggling with mental illness and homelessness, etc. Added stressors, say maybe to you, say in comparison to some others who once they leave the facility, they're not confronted with these issues.
Absolutely. I remember coming home during the pandemic and seeing people homeless on the street, you know, during the pandemic. I witnessed things that it was very difficult to come to terms with the hidden illnesses of our communities, Black and brown communities, that became uncovered during the pandemic. And you're right, it was one thing to deal with it in the hospital, but also to come home to it and to experience what we are really dealing with as a people, as a community, was very, very difficult as well. It adds to the entire, you know, picture that you're of stress that we're dealing with.
I know you mentioned when you were talking earlier about there are some initiatives underway to address this more broadly.
Yeah.
But are there any specific resources or places that you could identify if someone watching would want to perhaps learn more about or look into for themselves or even others? Oh yeah, the other question I wanted to ask you, how did you see or experience a difference in treatment or care that was provided to patients during this particular time because perhaps of some of the burnout or other issues that physicians were dealing with?
Well, we had a manpower shortage. I mean, we had people that couldn't come back to work, both physician and non-physicians that were not back to work. So those of us that were going to work were actually pushed even further because the patient volume didn't, you know, patients still needed to be taken care of, and we just didn't have the manpower. And I think that was the biggest thing that I saw, was that we had fewer human resources and still trying to, you know, deal with the heavy volume that we were experiencing. So I think that was the biggest difference that we noticed.
It's interesting because as you talked about the trauma and the what the physicians and nurses were going through during this time. It just sort of caused me to reflect and think about 9/11 as we went through that, because I was still in office as the Manhattan Borough President. And I remember one day calling our pastor to just say, you know, we were going to funerals, many people I knew but didn't know, but families and constituents and people who I knew supported me, etc. But no one was dealing with us emotionally.
Yeah. Yeah.
And I thought about that as you were, you know, speaking, not making a comparison, of course, but just situations that we go through. And that one was very, very difficult.
Well, you just triggered one for me, a memory for me that something I hadn't thought about that I experienced also. You know, I was in the hospital 6 days a week because we didn't have enough people during the pandemic. So whether you were an intensivist or not, you had to go into work, and I had to take care of critical care patients. But I remember thinking, I was on the unit taking care of critical care patients, which we had to open up extra units, and then finding out in my own clinic, my own office visit, finding out that there were patients of mine who were in a critical care unit that I didn't know and passed away. And the youngest one that I had, a young woman, 42 years old, a breast cancer patient of mine that I had just operated on less than a year prior and was doing well, except she had a history of asthma. So it wasn't the breast cancer that took, it was the fact that she had asthma and then got COVID.
And you were not aware that
I wasn't
she
even
was
aware. And the
critical
grief
care.
that I dealt with, because knowing that her mother didn't understand why I wasn't there, that I didn't come, I didn't know. There was so many, it was so chaotic, you know? And I just thought that was another memory that just popped up for me when you talk about all these funerals and all these things that were happening. We got lost in the shuffle, just trying to take care of everybody as best as we could.
And what you brought back was how we pay attention to the issue and the situation, and not pay attention to those who are providing the care, whether it's medical professions or professionals rather, or elected leaders or others who are on the spot. You know, on call 24/7.
So you were asking about resources. I think the first thing, if you're a healthcare provider, if we just talk about that, I would say go to in your own facility where you receive care. If it's a major hospital system, I would suspect that the Department of Psychiatry, Psychology, that they would actually be able to, you know, take care of you, provide services for you. There are some institutions that I know of in New York that have developed programs for frontline workers who have been through COVID and are dealing with these kinds of stress to actually, you know, take care of them. And I think they're open not only to their providers, but, you know, to other providers as well. But I think a good resource is your own Department of Psychiatry and Psychology, or even the New York State Medical Society. You know, these are some of the organizations that would be able to refer you to services, and then of course calling your insurance provider, you know, to find out.
So as we move to closure on this session, and I hope that this is not the last, because as I said, you have certainly awakened an awareness that I hope we will be able to continue having discussions and even making it more of a public discourse or discussions that we can, you know, have people to think about and be more supportive of the work and everything that you're doing. So are there any last minute comments or areas that you would like to mention that we've not?
No, I think the thing that I think the pandemic and coming out of this has brought to light for many of us, that it's really, really important that our sense of well-being involves not just those physical areas that we think about, but also that mental, you know, your mental well-being is really, really important, because it is associated with, you know, the onset that living with that level of stress can also bring on other illnesses as well, like high blood pressure and heart disease and stuff like that. So I think the only parting statement I'd have to say is that if you have any concern at all, if you notice any of these symptoms, no matter how small, anxiety, not sleeping well, loss of appetite, you know, feeling a little sad too often than you normally did, get checked. You know, just talk to someone, because there might be help out there that could actually improve the quality of your life. And I can tell you, for me, just talking about it has made the biggest difference. So.
And the advice you're giving to all of us is the same advice that perhaps our medical providers and nurses should be, as you have taken advantage of and been able to talk about so freely.
Physician, heal thyself. That's my parting words. Physician, heal thyself.
So the same good advice you're giving the rest of us,
yes,
the physician should be thinking about it.
Absolutely.
But that whole sense of moral, what was
the moral injury, injury from working in a profession that's sometimes at odds with your own personal morals. Yeah.
Well, you have certainly brought a lot to life in the discussion today, and I'm just so happy that you've been able to join us in terms of doing this. And I'm just delighted that you were able to join us, and we would like to thank you for joining us today. And for more information about our organization, I invite you to visit our website at nblch.org, and also look for us on Facebook, Twitter, Instagram, LinkedIn, and YouTube. The Manhattan Neighborhood Network brings these programs to you to better inform you, the viewer, about the important topics that impact your health and well-being. So please let your family, your friends, and your neighbors know about this program. I am C. Virginia Fields, and I thank once again my guest today, Dr. Bert Petersen, and I thank you for joining us, and hope that you'll tune in next time for Health Action TV here on Manhattan Neighborhood Network.